Namaste.
Namaste. You might have been seeing SBEBA regularly on my timeline and might be wondering what it is. Many of you know very well what is SBEBA. Many of you know that SBBA is somehow unique and standing out from conventional Ayurveda practice in many aspects.
And many of us will be knowing the objectives of this SBEBA, why we are this much specific about SBEBA or science-based, evidence-based Ayurveda.
So we know that the main problem which is faced in Ayurvedic scenario today is the inability to gauge physician reliability. Public cannot trust Ayurveda physicians completely because there is no consistency of Ayurveda, the way of practice among Ayurveda practitioners. The same situation, same clinical situation will be diagnosed by 10 physicians in 30 different ways. So the public cannot expect some uniform basic standards of quality from the way of practice of Ayurveda physicians. And we know there is uncertainty, there is a great component of uncertainty in Ayurveda practice. Physicians cannot say even to 10% or 5% what is the outcome of their prescription. So what they are telling is based on aimless predictions, based on their own experiences, self or shared experience. So there is a lot of uncertainty component in Ayurveda practice.
And so, also in academics, this uncertainty prevails. There is no certainty that after 5 years or 10 years or 15 years, this will get changed. It's becoming more and more towards Western medical system practice or principles they are oriented to, and always students are more oriented to Western research system. So there are no chances to find a solution with scientific Ayurveda. So the community is going like that. So for that only, this emergence of SBBA was inevitable, and we started this, coined this term science-based, evidence-based Ayurveda, and we started.
So the thing is that after completing our professional education, especially after completing BAMS, we both were feeling very uncomfortable and restless finding this scenario and taking lot of inspiration from our guru, late Padma Bhushan, Vaidya Bhushanam Raghavan Tirumapad sir, who always wanted to make the Ayurveda practice most simplified and at the same time utmost scientific and revolutionary. So taking all the blessings and inspiration from him, we have started our journey. So we understood that what specifically lacking today in Ayurveda practice is something which is fundamentally, rationally, there should be some standards, rational inbuilt standards in the science should be there. It is not meant to be personalized like expert opinion. Nowadays what is happening in Ayurveda is based on expert opinions or legends, legend oriented, eminence based practice. Certain people are considered to be great or legends. They are not qualitatively or quantitatively appraised or analyzed. Blindly they are judged as legends based on the honors they receive. So whatever they are saying, it is considered to be the ultimate thing which is truth, that and based on that people are practicing. And second, tradition led practices, whatever is running all these years in a family or all these years in Ayurveda, there will be some fixed protocols. When a case of paralysis comes, this should be the protocol 21 days irrespective of analysis of precise cause mechanisms happening, which can vary from subject to subject. So there are no pinpointed mechanisms to translate. There are lots of logics explained in the science, lots of medications and treatments, but Ayurveda is not written as a therapeutic formulary. Everything is explained with cause, mechanism, effect, relationship. So but this thing is not explored, this is not extrapolated, this is not researched, and finest standards for rational decision making are not existing in Ayurveda. This fact we have realized. So we have started working from that point from 2005.
From the very basics.
Yeah,
From the very basics means then only we will be able to do it in the most scientific manner. So we have started, we don't know really when it started, but uh, by the blessings of God and as well as our Guru, Raghavendra Lumpad sir, we started thinking in the right direction. We understood that it is in the right direction by seeing the results in patients. So whatever we have been discovering, we made the basics and we started exploring the modern day diseases. The nature of the diseases have changed when this Western medical system emerged and people started taking so many unwholesome food and regimen or practicing unwholesome regimen and these suppressing altering medications, their nature of response also have changed, and that resulted in development of many modern day diseases. So we started exploring with the basics of Ayurvedic science the modern day diseases like chikungunya. When this COVID-19 came, all the Ayurvedic doctors were in chaos, and they started giving lemon juice or basil leaf, clove. So many
Turmeric,
spices were used to, and thinking that virus is Bhuda Badha or something, krimis, and all these are Tridoshaja, and it will definitely cause, it can cause fatality. It is Anipadik Jora. So such vague and arbitrary diagnoses were done, and people are blindly giving some medicines and saying that this is beneficial and I have found this thing. So such things were prevailing, and we have started from basics, and we were able to explore the modern day diseases, including all sorts of infections and autoimmune diseases, which is very much prevalent in the society. That also, which we could explore in with the basics of Ayurvedic science, which are not mentioned in the science directly. So we need to explore it. We need to decipher it from the clues given and from the understanding of basics in the modern biology. So like that, we have explored so many things which are in the science, but from the real understanding of Shastrarthas or the intended objectives of scientific verses or sutras.
So people may think that it is your opinion, your belief. It is not our belief or opinion. That's why I told we have done basic research and applied research. First, we wanted to make sure that what we understand is correct. So for that, to make something, Ayurveda is a deterministic science. Cause-effect relationship or biological plausibility is established in the science. So we have to apply deductive reasoning approach, not the inductive reasoning. We have to start from the theorems. We don't have theories. We have theorems only in Ayurveda. So starting from theorems, logics and principles, we have started arriving at conclusions based on cause-effect relationship. And next what we did was, we wanted to apply what we have understood in clinical setting. So till now the main problems are for tackling a clinical situation. There is lot of dilemma in Ayurveda doctors, how to understand these diseases, modern age diseases. For resolving the morbidity of patient, there is lot of confusion, no right decisions, no rational decisions, no uniform decisions, no rational standards for tackling diseases, no predictability, no certainty. So what we have understood from basic research, that knowledge we have started documenting by ourselves. We wanted to apply these algorithms in real clinical setting patients, and we have been doing this right from 2004 and even 1 or 2 years before from onwards. And we have started, surprisingly, we have started observing that what we have understood from the science, cause-effect relationship, not like this medicine, wow, this medicine works in that disease. This is not what we are understanding. We are understanding that this principle, when applied in this diagnostic, this particular pathophysiology, these cause mechanisms are getting reversed back to health. So this we are able to estimate, we are able to observe, observational evidence is there. So we are analyzing the cause mechanisms in the patient. In Ayurveda, it's not possible to diagnose a disease outside the patient or in the lab. That is the uniqueness of Ayurveda. Ayurveda can diagnose and reverse a disease only in the patient. So no matter how much...
That too by exploring the patient to its core. So from its deepest level we need to understand. For that we need to have the thorough knowledge of basics. So with that thorough knowledge of basics, when we are exploring the patient, we will be able to explore fully. If we know to explore, that if we know to apply the Shastrarthas.
So there are different types of diseases today. So we have started thinking from that direction. Immune mediated diseases, infective and inflammatory diseases, the biggest challenge to modern world, even to modern medicine also, are infective so-called viral fevers, bacterial fevers, etc. But Ayurvedic science have got such a vast subject, vast chapter written on fever as a disease and not a symptom. So first thing what we have done is completely exploring these basic principles of decision making
in colleges,
in fever.
All these slokas are taught, all the slokas from treatment is taught, but nobody knows how to apply. Whenever teacher gets a fever, the teacher used to go to a take paracetamol or go to a Western medical system physician. So we never saw, or we have never experienced the clinical application of these infective conditions or inflammatory conditions in a clinical setting. Only this scientific knowledge was taught in the class without any practical application.
So like this immune mediated infection, number one, inflammation. Number two, we have started applying the algorithms which we have developed from our understanding of basic research output. We were translating into clinical situations, and it was shockingly realized, it was surprised, it was the most pleasant surprise that with fragmented dosages of medicine, nowadays in Ayurveda practice, bulks and bulks of medications are being prescribed for one condition in a patient. So we don't need to prescribe in bulk. We can approach a disease, we can approach a patient with fragmented dosage medication dose. So it was like a most blessing moments for us, and we have started, subsequently we have started our research, applied research in autoimmune diseases, allergic conditions, inflammatory conditions, metabolic diseases, then what do you call hypertension like diabetes, hypertension, hypothyroid, all the acute and chronic conditions we have started simultaneously. This doesn't require to be done one thing after the another, because everything is interconnected. Ayurveda advocates the practice of functional medicine. Once we are going deeper and deeper into the basic principles, we are able to interconnect human being, different tissues, organs, systems, pathologies, everything we are able to interconnect, and we are able to analyze cause, mechanism, effect relationship of multiple diseases coexisting in the human being at the same time. So it was like a greatest, biggest motivation for us to do this kind of translational research, and we have arrived at certain conclusions. We have decided to publish what we have concluded, because something we were able to conclude in the bottom level, that was the biggest success of SBBA. Right now there may be so many people who are working, but there are no conclusions in Ayurveda. That is why they are getting completely confused. What is not getting confirmed. So they are teaching like this can be this can be that, everything is okay. Everything is not okay in a science. Science means there should be a knowledge where standardization is possible. Science explains laws of nature. So for this cause, that is what is called biological plausibility. For this cause, this effect, this mechanism. So the interrelationship between cause, mechanism and effect is proven and established in science. So what we are doing in research is we are verifying what we are understanding in research. This is what we are doing in physics, chemistry and biology labs. what we are understanding, especially physics and chemistry. We are understanding logics, we are verifying it in the lab. Same way, we have understood logics from by basic research and we have started applying. So our first publication, evidence-based Ayurveda and rational prescribing.
So at that time we realized that Ayurveda shouldn't be in this status because it has got this much unfathomable, fabulous knowledge, clinical applied knowledge. So when we are not doing, after understanding if we are not doing, so she coined the term SBEBA, science-based, evidence-based Ayurveda itself, because it's not contemporary Ayurvedic science which is being practiced by others, because these modern day diseases were explored and Ayurvedic scientific principles how to apply were deciphered, and more we decipher, more and more we feel sad because this much potential science is getting deprived, it's not coming out. So we wanted to bring it out. So for the sole objective of bringing this potential of this Ayurvedic science, we coined the term SBEBA and we started taking classes for that, including these books were published. And 2012 she started publishing this evidence-based Ayurveda. After that only we coined the term science-based, evidence-based Ayurveda.
So science-based, evidence-based Ayurveda is technically defined also. It is the conscientious, explicit, judicious employment of science-based evidences. Ayurvedic science-based evidences. In modern medicine, outbuilt evidence is sufficient because they are starting from an unknown compound. We are not supposed to start from anything unknown in Ayurvedic science because Ayurveda is a deterministic science. It is not a probabilistic medicine-oriented science. It is a deterministic science-oriented medicine. So anything we want to prove, verify or establish, we should start from the science. So it is the conscientious, explicit and judicious employment of science-based evidence. To prove something as evidence-based medicine, first of all, the physician must be sure that what he is practicing is approved by science, science of Ayurveda. For that, rational standards are to emerge. It is not like my intuition is that I am correct. It is wrong. There can be subjective bias. My faculty taught me this, so he is a legend, so this is correct. This is wrong. Belief-based system, it is wrong. Tradition-based system, it is wrong. Expert opinion-based system, it is wrong. So we should have rational standards emerging from the science.
So application of deductive reasoning comes only after understanding the basics. So that basic understanding, with that basic understanding, we started developing deductive reasoning. How to develop deductive reasoning in the patient, individualized. So from there we started and we named it science-based, evidence-based. It's not like Dr. Rajkumar's or Dr. Remyakshan's science, or we have totally ignored all Charaka, Susurda, Vakpada, etc. It's only from the science.
We wanted to emerge science of Ayurveda as it is.
As it is.
And not what we want it to be. We wanted it to be exposed, the potential, accuracy, everything to be exposed as it is, without any sort of adulteration. And we wanted to induce science consciousness in every Ayurveda physician. Right now, what is science consciousness? Biostatistics consciousness is considered to be science consciousness, which is deeply flawed in Ayurveda. I told the reason already. Ayurveda is a deterministic science. Number two, Ayurveda needs deductive reasoning, not from general to, actually Ayurveda travels in the direction general to specific and not from specific to general. Based on one observation, we cannot make generalized conclusions. So these things were very much clarified, and then we have developed evidence triad approach, the main golden standard of practicing science-based, evidence-based Ayurveda.
So in the evidence triad approach, the basic level, silver evidence also, if one practices, that will be very much scientific, very much superior than what contemporary practice is. So when we go to golden evidence and diamond evidence, this is the most perfect way of application of Ayurvedic science. So this is the only one and only way to perfect practice of Ayurveda as it is, as well as we could decipher all these. That doesn't mean that we are perfect and we are infallible. So we are also learning, and we are also learning along with all other SBBA aspirants.
The point is that we have got a direction which is accurate to proceed. That's all. That direction is accurate because it is confirmed with basic research, and we are able to get transparency and reproducibility, the two hallmarks of scientificity. Transparency, we are able to explain what we are doing, what our intention is, what the patient can expect, and we are able to connect that. What the patient is expecting and what the patient is getting, we are able to connect with what we are doing and how we can explain it. That is called transparency. And reproducibility, we are not asking every other Ayurveda doctor whom we are training to repeat the same medications what we are using in this disease. We are teaching them these logics, these rational standards, evidence-tried approach, methodologies.
And how to culture their intellect.
In every individual patient, how you can do justice, how you have to reach rational diagnosis, how you can make rational approach in treatment by doing step-by-step methods. So there should be standards in evidence-based medicine. We cannot do something and claim it as when we get some benefit risk data, it doesn't make any sense in Ayurveda, because Ayurveda is not a medical system intended to produce some benefit risk. Ayurveda is a medical science where the physician is asked to do reversal of the disease. How much it is possible is depending on the prognostic standards. But the objective is to reverse the disease, not doing any adjustment by blocking, masking, etc. So such kind of precision methodologies, tools, algorithms are developed in SBEBA.
Which were not there for centuries. Because the modern, with the advent of Western science, so many new diseases developed, and Ayurvedic physicians were not able to comprehend all these changes, and they have been practicing the same thing as before. So they were not able to cope up with the Western medical system knowledge. And they have been giving medicines along with Western medical system because they were not confident.
Yeah.
They were not confident to stop all those Western medical system prescriptions because they were ignorant of the cause mechanisms in the present day modern diseases. So this SBEBA has to emerge for the dignity and
identity of medical science.
Actually, of Ayurvedic medical science.
Yeah, Ayurveda is not intended to be suppressed like this. Ayurveda is an independent medical science. Ayurveda has to get recognition as an independent medical science. We don't need this what you call methodologies of analytical reductionism to prove our science, because our science has its own inbuilt methodologies, its own inbuilt decision making algorithms, which need to be, as it is highly vast and complicated, there had to be some attempts to pinpointedly identify the algorithms, methods, techniques, and develop it, update it according to conventional needs. And this is the work what we have done in SBBA. So once it is emerging, we wanted to make sure that science of Ayurveda has to emerge and get globally recognized as it is. And we know that we are very sure that it will happen only by the standards of SBEBA, science-based, evidence-based Ayurveda, which is made suited to every individual patient. So the definition is science-based, evidence-based Ayurveda is the conscientious, explicit, judicious employment of inbuilt Ayurvedic science-based standards in accordance to variable clinical situations in every individual patient. So we are not losing the individuality, but at the same time those subjective variations are explainable by certain objective standards which are inbuilt in Ayurvedic science, by means of which we can standardize the clinical decisions in Ayurveda. So this is something really revolutionary in Ayurveda practice.
So we started giving proposals to administrators. Also we started taking classes. With the objective, sole objective of making this SBBA practice to emerge.
Yeah.
So SBBA practice once emerges from some practitioners, it will become finally, this is revolutionary because it produces quick and most effective changes which are possible with natural means. So this scientific approach, if is adopted in India or in whichever state they are, definitely their economic status will improve. The patients, the subjects will be healthy very much,
Yeah.
and we will be economically stable, and we can become a developed country even.
So nowadays, multi-system inflammation is the biggest challenge for modern medicine. So when we are, last week I got a patient with, she was having rheumatoid arthritis, she developed an inflammation in her eye, and with the same principle I have applied for rheumatoid arthritis, her eye inflammation also got resolved. So this is like her eye, she went to an eye doctor, she was a nurse, she went to an eye doctor, and he started prescribing so many medicines, anti-inflammatory, ophthalmology. So she told, I'm taking a medication from Ayurveda, which my doctor told will reverse inflammation in eye also. Oh, is there such a thing in Ayurveda? That ophthalmologist was asking. So such a thing in Ayurveda is not yet in, exposed in the society unless a physician has learned deeply and practicing SBBA. So we have trained lots of physicians, and they are doing this in inflammatory conditions confidently, and they know the big variation between before what they were doing and now they are doing, and many of them are openly revealing that SBBA has become a big cause for their tremendous change in their life and career. That
And
also.
we are doing Hastalamba VFFA, viral fever first aid also. Our team with coordinators, doctors, they are dealing all these infective fevers
Yeah,
very
in all
confidently.
stages.
Means they are young doctors, they are not legends of Ayurveda, because of SBEBA, its transparency and predictability.
Yeah.
They are also able to manage all these conditions within 5 days, 5 to 7 days,
Without any medication. It is a
without any
first aid.
medication. So that itself proves the scientificity of Ayurvedic science. So that was only possible with science-based, evidence-based Ayurveda, and we started getting so many oppositions, and for each and everything they started questioning us, like you are above Charaga or Sushruta or Vakpada.
Without understanding, they are criticizing. It is
Because
blind criticism.
they think that this is for our propagation. We wanted to become famous, and we wanted to get awards. That's what they think, and they started opposing. Means whenever we get a program, sometimes it will be cancelled, or sometimes people will not be allowed to participate, and the organizers itself will be disappearing. Such situations happened in reputed institutions also. So like this, then also God blessed us, or God blessed the science to reach so many people, so many doctors. We got so many platforms, and we were able to convince so many doctors, and many have transformed to SBBA practitioners. And we have also seen some, ironically, after learning all these things, again they are going back and saying that all our teachers have taught us, and we have directly learned from Charaka, we have directly learned from Susruta. So these people need not tell that everything is SBEBA. So such comments started coming. So for this only we are doing this video. So coming to the point, we will be discussing.
So the thing is that once, if this was being taught, everything is there in Samhitas. Everything is there. There is nothing in SBBA which is out of Samhitas.
That's what science-based, evidence-based.
That is why we have coined the term science-based, evidence-based. And all these doctors who have joined us felt that the component of precision, transparency, certainty, etc. were lacking. They were not confident enough to handle their patients. They didn't have a definite structure of algorithms to arrive at conclusive decisions in their clinical practice. Can be, cannot be, maybe, may not be. Once a situation gets altered in the patient, unable to say what will happen, they will refer to modern medicine. So lots and lots of problems. That is why Ayurveda doctors ran for COVID vaccine. It's not that always because of mandate. First of all, there was no mandate. Second, the Ayurveda doctors were not confident enough to stand on their own feet. Otherwise, just imagine the faculties who are teaching fever, infections, which is written as a biggest chapter in Ayurveda. They were teaching fever and all cause mechanisms
After
of fever,
taking 3
and
doses of
then
vaccine.
they were going to take 2-3 doses of vaccine. So that itself, so the things are very clear that the diffidence of Ayurveda doctors are prominent. So once they enter this SBEBA world, they are made systematically trained regarding all the algorithms. Once a patient comes, what to do step by step, how to analyze, how to understand a disease. See, these things are meant to happen in the college, which are not happening. How to understand dengue fever. 100 faculties will give 1000 comments. No conclusions. So that is why they don't know how to treat dengue fever or chikungunya or whatever it is. So once they are entering SBBA, they are taught this disease understanding, patient understanding, treatment understanding, how to choose treatment, etc., etc. And they are learning step by step. It's not that with one seminar or 2 seminars or 3 sessions they are learning everything, but they are getting a what you call thunderbolt realization that wow, this is something. It's not that self-boasting what we are doing. We felt the same when we understand. When we started to understand things in Ayurveda, we felt the same.
In all
Wow,
our
what a
CMEs,
science! What a science this is. We also felt that wow. So that,
they have been learning by asking so many questions.
yeah, we
So
encourage
2
questions.
days CMEs will be having, and from morning to night they will be asking questions, and they will be
After
clarifying.
CME
After
also.
CME also,
Yeah.
they will be clarifying things, and at times when patients come, they will also discuss with us. And after all this,
After everything clarified, most of the things clarified, they will go back, they will share.
when they become confident to treat their own infections, or when they are able to treat some diabetes or hypertension or autoimmune conditions, they become confident, and then they say that
It is
we
their
are treating from Ayurvedic science itself and not from SBEBA, or we are doing some sports medicine also and not SBBA
Yeah.
alone, or we will be saying that
blah blah blah.
I
We
am
are doing
doing
tribal
twen-
medicine also, and we are doing that medicine, this medicine, everything.
so I am doing science-based
Science-based
Ayurveda.
medicine.
Science-based Ayurveda. So I am doing science-based Ayurveda. I have learned from very old teachers or legend teachers. I cannot ignore my teachers. We never said that you should ignore all your teachers, because all of them have taught you in the college. That doesn't mean that you are able to treat your patients. We made the methodology to identify, diagnose, and treat modern day diseases with exact Ayurvedic scientific principles.
Comprehension.
So that method is not at all there in any of these colleges or any of these paramparas or with any legends. So when we wanted to bring this science out, or what we have been seeing all these years, this science is not at all there in the health department. Even when COVID treatment protocols were made, there were no Ayurvedic doctors, because they don't belong to health.
Only
health
supportive
department.
care. Later
Supportive care,
supportive
they can
care.
do business with Ayurvedic medicines.
Yeah.
That's all. So this status we wanted to change. When we are teaching them all these things without any inhibition, without any hidden things, and when they start learning and when they become confident, they forget everything and they will say that their gurus taught them. So their gurus,
Not only that,
we are
their
not
gurus.
asking them to ignore their first standard or 10th standard teachers and all the Ayurvedic teachers, they should ignore. It's not that when they are following this method, it's an addiction. Once they start following this method, they cannot deviate from this.
it. Yeah.
So when they are practicing this method, they can acknowledge all their teachers, but they should definitely
Acknowledge
say
them.
that what they are doing is SBEBA itself. It's not
Methodology.
science-based Ayurveda or science-based something else.
New generation Vaidya.
Ah.
Some people are
Ah.
doing.
And when we ask them to say that it is SBEBA, they will be saying that you are arrogant.
We
So
are,
after learning all this, what after PG and PhD, they didn't learn the clinical application, and when they have attended
All
some
the
5 to
same.
6 CMEs, and by learning from our books, when they realize that they can apply, they can also apply, they started telling that we are arrogant, asking them to tell that what they are practicing is SBEBA. Many are there. Some are telling as 21st century medicine. Some are telling that they are using some other methods also to treat diseases. They are making their own medicines. So it's not SBEBA. And again, the status of science after 100 years, again,
remains the same.
status of Ayurvedic science.
Nobody
remains
is
the same.
thinking that if when Ayurveda has to be globally recognized, it can happen only by the evidence-based practice. And till now, there is no concluded, confirmed, established, confident declaration of evidence-based practice in Ayurveda. What people are doing is adopting RCTs. RCTs, if they are successful methods in Ayurveda, still Ayurveda will be counted as pseudo science by and not getting recognized in the Europe. And definitely you may say that Ayurveda is recognized in Europe. What recognition? Are you recognized as a doctor in Europe? Are you recognized as a doctor equivalent to modern medicine in Europe?
In India even.
Not even in India, no. So which means that what you are calling this as RCT and all, everything is stupid pathway in Ayurveda. Ayurveda can progress, evolve, emerge, scientifically established only by Ayurvedic
as an
techniques.
independent system.
As an independent system by Ayurveda logics and methods. So you should understand one thing, those doctors who are learning SBBA secretly, there are doctors who attend SBBA seminars secretly and go away without a word of gratitude. When the valedictory function is going on, we have seen some doctors getting away from there. Till the last minute they were sitting and listening to us, writing down notes.
Asking questions,
asking questions, endless questions, and getting away from the quickly from the place when valedictory function and feedback session starts. So this is what Ayurveda doctors are showing majority. I'm sorry if I have hurt your feelings, but this is the reality. I should say this because we also have feelings. We have feelings for science more than for ourselves. So we feel sad because we are trying our level best to expose the accuracy, scientificity, potential of science through all of you. SBBA aspirants who are joining this mission, who are learning this mission, you are getting recognized about the scientificity. You are getting confident in your practice by SBBA. You know that and we know that. So why don't you expose it as SBBA method? I'm an SBBA practitioner. I may be flawed, but I am adopting that techniques to improve myself. It's not like there is no end to perfection. We are not perfect, but we are also learning SBBA, and we are proud to announce that we are SBBA practitioners or pioneers.
They will not be telling that they are SBBA practitioners because they can be wrong also. So they will not be telling that we are SBBA practitioners, but we also can go wrong.
Yeah.
They cannot reveal that.
That is a very foolish way of justifying things. Because
so they are selfish, they want honor and dignity in the society, but they cannot reveal SBBA.
What is wrong in SBBA? SBBA was the roots of your success, for the roots of your confidence, the roots of your integrity, your own health and your family health. Then what is the problem in revealing SBBA? I don't understand. I think it's a period of curse for the medical system, because even though we have emerged a methodology, still it is in pending in decision making in government. We are there in expert committee. We have given suggestions to Ministry of Health, Ministry of Ayush, everywhere. Everything is kept in pending. And secondly, those doctors, many of the doctors, principal of our college, he was telling SBBA is Lingayya's hair oil. He doesn't know anything about SBBA. He doesn't want to know also. and he went from class to class in our college along with other 10 head of the departments and told bad things about the mission of SBBA without knowing ABCD of SBBA. And because of SBBA, we were having lots of adversities. When we get patients, our OPDs was cut down in our own college. Can you imagine such a thing in an institution where government institution where patients are coming from different parts of Kerala and India for quality treatment, asking for SBBA or asking for those who practice SBBA, one sudden morning OPDs are cut. So this is what is happening unfortunately in the field of Ayurveda, and this is why Ayurveda is not taking the next step of progress. This is what I think.
So what we wanted to reveal is we are not going to lose anything.
And we are not going to stop this also.
We are not going to stop this also. We have got such responses from Gujarat, one doctor who has been practicing, one or two doctors from Maharashtra, one doctor from Kerala, and before one doctor from Goa, and so many other doctors from Goa followed them. And we got such experiences after understanding the clinical application of Ayurvedic science. They started telling that we have learned from Charaka, we have learned directly from Susruta and Vakpada, and we need not consider this as SBEBA. They have been learning from our books, they have been continuously and they have been taking treatment for their ailments as well as their parents' ailments from us, and finally they are saying that they are following Charaka Susruta. So this is self-destructive. Because of your selfishness and you wanted to get dignity and honor in the society, you are destroying our science. The true the status which our Ayurvedic science deserves, you are spoiling that. That's what we wanted to tell.
So SBBA doctors, if we are uniting with the will of taking this science consciousness movement ahead, SBBA science consciousness movement. So in order to take this ahead, definitely we are not forgetting the fact that there are plenty of doctors who are immensely obliged and grateful to the mission of SBBA, and there are doctors who openly reveal that it is SBBA which has caused the major transformation in them. And second, we are not craving for recognition of ourselves as individuals. If any person who is watching this thinks so, it is your own problem. If you think so that these people are craving for recognition, they are not getting it. It's not that, but yes, we are craving for recognition of the science.
Yeah.
If our science is not getting recognized, no matter how much recognition we get as an individual, doesn't matter at all. So we are applying our knowledge and our skills by the grace of God. We are applying with the sole intention and sole objectivity of taking the science and exposing it as it is. This is our true intention and objective. Just wanted to reveal this because nowadays so many practitioners, we become really surprised, and sometimes it is funny. Sometimes it is funny to watch that these doctors were learning this much, they have been benefited individually. The immense transformation has happened in their disease status, life status, family status, everything health-wise. And finally, when they share their success stories, it will be their hospital, science-based Ayurveda or scientific Ayurveda, and
nowhere there will be SBEBA.
So just imagine when Western medicine doctors start doing this, like scientific medicine, Western medicine, their hospital name, then evidence-based practice would not have been recognized like this. Evidence-based medicine was the foundation for them to expand, evolve and establish. So Ayurveda doctors who are joining SBBA mission,
they are very much selfish.
Understand.
Those who are doing like this are very much selfish.
And
So
ignorant also.
ignorant
They don't
also.
know about the consequences of doing that.
Next generation, what will happen? They are not thinking at all.
Yeah.
So
We will conclude.
yeah.
Yeah.
So we pray God to give self-realization to all these doctors who have underwent SBEBA training and or who have attended CMEs of SBEBA. We pray God for self-realization of all the doctors, all the Ayurvedic doctors, to start practicing Ayurvedic science as it is, and
Through SBBA.
let it become the sole motive of their learning and practice, and let it be for universal well-being. Loka samasta sukhino bhavantu. Thank you.